Hi, I'm Dr. Sebastian Gonzalez at Performance Place Sports Care. This video is going to be on some of the things you probably can do with lateral elbow pain. So it's going to be right out here. Typically it's called lateral epicondylitis or lateral epicondylasia, or lateral epicondylosis probably is in there. But basically a lot of times it will become aggravated with gripping, pulling motions, and it can be from a variety of things. So we're not going to be talking about the pathology or how it happens today. We're going to talk more so in the aspect of things you can probably do in regards to rehabbing around it. There's a concept with sports injuries, or actually injuries in general, we call fear avoidance, where people are usually afraid for a certain period of time, maybe for a long time, about if they do this, that, or whatever, they're going to become hurt or it's going to hurt that area. And it's not always the case. Usually when we develop rehab programs here, it's more about testing. Think about yourself as an experiment. Usually you keep all these variables the same and you change one. So we need to figure out programs which work out for each person individually, because everyone's case is different. Now, this is going to be on the 3 things that you can probably do, or ways you can modify for elbow conditions like this. Again, talk to your healthcare provider and your strength coach and really bounce these ideas off them. They might say yes or no, but again, it's good to have guidance. This is mainly for, it's pure educational. So here we go. Actually, the number one thing that I would probably emphasize for people who like to do powerlifting, Olympic lifting, CrossFit, you want to make sure that on your power lifts, you want to make sure you're not pulling early. And pulling early, or a lot of times you're not finishing with the hips and you pull early with the elbow, which eventually it'll hurt this section here. You might know some people who already have it. Also too, pull-ups are going to be an issue. So we're going to show you a way to decrease the amount of load on the area while you're doing pull-ups, or rowing motions will be our third modification. So a lot of it will revolve around time under tension and also grip position. Okay, so we're going to go over some clean technique just roughly. Early pulling with the elbows is something that, so demonstrate for me. So a lot of times they leave their hips behind, and I'll go around the side here. So she's leaving her hips way behind, which is the most powerful aspect of the clean, and she's pulling early with the elbows. Give me one more there because it was kind of quick. So a good exercise to do, or a drill to do, is to keep the elbows locked and you terminally extend the hip and bump the bar. Or she's going a little bit more, so try an actual bump out front. Good. So there's a couple progressions to do, and there's actually a video if you go online and check out how to teach a power clean. It'll go over some of these progressions. Again, notice she's keeping the elbow locked, and this is a good technique just to make sure that they're not pulling early, because that's going to keep irritating the elbow.
Now, modifications of pull-ups is going to be something which is going to be really challenging with any lateral elbow pain condition. Some people opt to just take them out completely. With this, we're actually going to add a band, and this is going to be mainly for we're going to increase muscular time under tension. Again, she doesn't actually need the band. She can do pull-ups without, but she's doing very, very slow reps. Or you can actually go to the point where you can just do dead hangs. Both are okay, but again, this is something you have to keep an eye on. A lot of these pulling motions, you have to really decrease the amount of grip time you have if you have lateral elbow pain.
Now, another modification of grip is to also we can change the angle and overall the load in this manner as well. She can also turn the wrists in a different position, like to palms together. This will change it a little bit as well. Overall, if you're having elbow issues, we're talking about mainly, gripping is something that's going to significantly irritate it. So I'd suggest definitely have to get a correct diagnosis on it. But if your doctor allows it, or your strength coach allows it, we can do modifications of grip in this manner to still keep some load on the tissues and the tendons, but not significantly irritating them. So again, you notice that she's basically planking, she's keeping the hips up, so there is a requirement of core in here as well. She's still able to work the shoulder blade, but doing a slow rep right here as well is going to be helpful with decreasing the amount of eccentric contraction or ripping effect on the tendon as well. Thanks for watching. Hope it was helpful. Again, These are not intended to be set in stone. Talk to your healthcare provider, your sports med doc, your strength coach, and I'm sure they will echo the things which will work for your individual condition, because no one's is exactly the same. Go onto our website. You can reach me, p2sportscare.com, or listen to our podcast on iTunes. It's Performance Play Sports Care, and like our stuff, share our stuff. These videos, comment on the bottom. I really try to do my best to get in there and answer these. There are certain things I can't answer, so keep that in mind, just because of healthcare law. So again, share these. I really thank you a lot. Thanks. Take care.